Welcome back to Fit Families TV. Today, the plot will thicken as we talk about ADHD treatment with medication. First, I want to talk about Dr. Peter Breggin, who argues in the literature with Russell Barkley about the treatment of kids with ADHD drugs. What Peter Breggin argues is that stimulants are powerful drugs that have problematic consequences, both psychologically and physically, for children. Dr. Barkley argues that stimulants are okay to treat kids with, and they're useful in terms of helping kids to manage ADHD. What's distressing is that there wasn't a more thorough debate in the literature about this topic. And what appears to have happened is a huge amount of momentum for the treatment of ADHD with drugs starts to accumulate after that MTA study published in 2001. So when you look worldwide, you start to see trends of this process happening. Global use of ADHD medications rose threefold from 1993 to 2003, and global spending rose 9 times from 1993 to 2003. The United States led the charge with the highest rates of spending and use of ADHD medications, with countries like Australia and Canada following. However, several developed nations followed this trend. For example, a study assessing future expense until 2012 of Germany and England also expressed very high multiples of the use of ADHD medications and the expenditure for ADHD medications. As a matter of fact, the degree was so high that they start to question the cost effectiveness of the use of ADHD medications. In another country, the Netherlands, from 1996 to 2006, the expense for ADHD medications rose 8 times. So what you see in these patterns after 2001, when the initial results of the MTA study were published, is that worldwide, with the United States leading the charge, expense and use of ADHD medications has escalated. Now here's the surprising part. These trends were established before the follow-up study, which was published in 2009. In that study, which was 6 to 8 years after the initial study, the results are stunning. What they found was those 4 treatment groups that originally there were significant differences between them, those groups were now indistinguishable. So what that meant was that these considered to be excellent treatment of these different approaches were basically the same. So, for example, routine community care turned out to be as effective or ineffective as a combination of the best medication monitoring with behavior intervention. That in itself is shocking. What it suggests is what we thought in 2001 was correct isn't really correct, but it's especially disconcerting when you consider the fact that these kids 6 to 8 years later, when compared with controls, were worse on 91% of the variables. So what that means for you is essentially none of these treatments worked the way that we want them to, because these kids weren't better than control groups. The control groups were kids who were matched, but they didn't have ADHD. The whole intent of this intervention is to help these kids so that they are able to do as well as kids who are like them but don't have ADHD. None of these interventions did that. So what we have now is a worldwide focus on medicating kids with ADHD, yet the results show that kids were 91% worse on the variables on which we compared them. So what we've had to do is we have to go back essentially to the drawing board. When I first read these results, they were so shocking that I actually have to read them to you. So let me grab this and read it to you. The type or intensity of 14 months of treatment for ADHD in childhood does not predict future functioning 6 to 8 years later. Rather, early ADHD symptom trajectory, regardless of treatment type, is prognostic. This finding implies that children with behavioral and social demographic advantage with the best response to any treatment will have the best long-term prognosis. As a group, however, despite initial symptom improvement during treatment that is largely maintained after treatment, children with combined type ADHD exhibit significant impairment in adolescence. I'm going to go back and unpack that a little bit here in a minute. The last point they make, which I think is absolutely critical, is what I thought in 2005, is innovative treatment approaches targeting specific areas of adolescent impairment are needed. Now let me go back to some of these statements here. Basically what they're saying is that the kids who came from better families who had only slight problems with ADHD did better. The kids who came from worse families who had worse symptoms and had worse initial reactions to the treatment that they did had worse outcomes, which is kind of like saying really nothing. We kind of knew that those kids would do better than the other kids. Really what they're saying is that these interventions didn't work. And the last statement emphasizes that, because what they say is that innovative treatment approaches targeting specific areas of adolescent impairment are needed. Now there's another statement earlier in that paragraph that's confusing, and here it is they say, despite initial symptom improvement during treatment that is largely maintained after treatment, children with combined ADHD exhibit significant impairment in adolescence. What that seems to suggest is that even if, let's say, a kid is doing a little better on those original symptoms of inattention or hyperactivity, they aren't able to transfer or generalize that into better skills. So that means that they aren't able to do better academically. They aren't able to do better with their social skills. So they're not able to generalize what we thought they would generalize. So even though maybe they did better on some of those little circumscribed symptoms that are related to ADHD, overall, they're not doing better. They're faring worse in terms of socially, delinquency, academically. So to me, this is an absolutely stunning study, and really the only substantial long-term study of ADHD that compares treatments, and essentially it seems to be being ignored. And it's swallowed up by this unbelievable worldwide movement to medicate kids with ADHD medications. I'm Dr. Charles Schiniver. Thanks for watching Fit Families TV.